Let's get some perspective on this story now. We have John Campbell with us. He's a health analyst and educator in Carlisle, England. Hi, John. Good to have you with us. Why do you think that we're seeing this spike in cases in regions and in countries really across Europe, not just in France?
I think we're actually paying the consequences of what happened over the summertime. In summertime, the cases went down and people thought things were getting much better. So there was quite a lot of tourism. So a lot of people went on holiday to Spain. A lot of people from France went abroad and came back, and that was spreading the virus around. And as well as that, in summertime, as you would expect, of course, nice summer evenings, young people out drinking, out socializing. And that was a major driver of infection. The infection was spreading amongst young people. But because young people usually get minimally symptomatic or even asymptomatic disease, they weren't really suffering from it themselves. But what they were doing is they were going home, taking it to their parents' generation and their grandparents' generation. So what we're now seeing, as well as the increase in young people across Europe, the increase in the older people and indeed in the elderly now, which is a concern because more of these are going to get sick and some are going to potentially die, unfortunately.
And John, the result is that we do now see infection levels in some regions and in some countries that are similar to those that we saw at the beginning of the pandemic. But are we better able to handle outbreaks now compared to that time?
That's a very good observation. The numbers are quite similar, but testing is way better now. So we've estimated that the numbers back in February, March, April in the UK was something like 50 times underestimated. So the numbers we're getting now in reality aren't yet as high, although they appear to be on the graphs. So we're not quite back to where we were. But in terms of being better prepared, yes, of course we are. We're massively better prepared. We've got the contact tracing apps in most countries. We've got data collecting facilities. People are well educated. Everyone knows about hand hygiene, face coverings, spaces between individuals. These things are well known now. The problem is motivation. There's been quite a bit of COVID fatigue over the last month or two. People are just fed up of this. Understandable, of course, but the point is the virus has not gone away. 80 to 90% of the population of Europe is probably still susceptible to this virus. They can still get it. They're still relatively naive to this virus and can get it. And there's no question we can see greatly increasing cases this winter if we don't act really quite quickly.
Well, John, let's take a look now at the race for the vaccine, which is ongoing. You know, Russia has registered Sputnik 5 as the world's first vaccine against the coronavirus. A lot of scientists say it is too early for widespread use. Let's take a look.
Washing his hands multiple times a day, just one of a series of hygiene measures Semyon Galperin undertakes. The doctor doesn't want to take any chances with coronavirus, but he knows a vaccine would offer the best protection against COVID-19. That's why he's volunteered to take part in testing a new Russian one. Someone has to do it. Without clinical trials, there are no medicines. The effectiveness of a vaccine can only be evaluated in the third phase of clinical trials. The stage 3 trials began 3 weeks ago, but the vaccine, which has been named Sputnik 5, was already licensed in August, before they began. And mass inoculation in Russia is planned for later this year, something numerous experts have sharply criticized. The Russian government has rejected the criticism. It says the vaccine has been developed from already known substances and doesn't pose any health risks. Russia urgently needs an effective vaccine. The country currently has the 4th highest number of coronavirus cases worldwide, and the numbers continue to rise, with around 6,000 new infections each day. Galperin and other doctors say they're not worried about the vaccine's safety. After all, the vaccine has already been tested on several well-known public people, and they're doing well. These public figures include Russian Defense Minister Sergei Shoigu, Moscow Mayor Sergei Sobyanin, and one of President Vladimir Putin's daughters. Potent PR material. It's part of Russia's strategic interests to always want to be first, irrespective of whether it's a revolution or the first flight into space. Now it's about saying that we're the first to develop a vaccine. Internally, we're showing that the situation is under control. Externally, it's a signal that Russia is still mastering its role as savior of the world. Semyon Galperin isn't thinking about his country's PR plans just now. The doctor is here because he's hoping to help win the fight against the coronavirus pandemic. People are tired. They want it to be over. The new vaccine can help calm people and offer a way out of the situation. It will most likely be at least several months until the results of the phase 3 trials are known. Only then can the actual effectiveness and safety of Russia's Sputnik V vaccine be assessed.
So, John, if this vaccine were to be made available to you, would you take it?
It's a very interesting question, isn't it? The answer at the moment is no. Now, this Russian vaccine is actually based on Western vaccines. It's an adenovirus vaccine. Some people even suggest that the Russians were highly influenced by ongoing data that was being conducted and ongoing research in Western countries. So they've developed this vaccine and they're actually rolling it out now. Now, vaccines, like any drug, normally goes through 3 phases of clinical trials. And the phase 1 and the phase 2 clinical trials for this vaccine in Russia have been questioned by Western peer review. They're unsure about what's going on. And normally, like what we've done in the UK and in the United States, we've launched large phase 3 clinical trials, testing the new vaccine against another vaccine or against a placebo to see if it works in the real situation. And basically, the Russians have simply not done this. They've skipped phase 3 clinical trials after questionable phase 1 and phase 2 clinical trials. Now, there's 2 things we need to know about a vaccine. One is, does it work? And the second is it safe? Now, the data on the Russian vaccine indicates that it's almost certainly going to work. So I do expect this to be efficacious. I do expect it to generate a degree of immunity. But what we're so careful about in the Western countries, in Europe and the United States, is making sure it's safe. And the only way we can guarantee that it's safe is by having large-scale clinical trials. So to say it's been tested on Vladimir Putin's daughter and the mayor of Russia, you can't argue from 2 or 3 individual cases. We need large numbers of cases to demonstrate safely. And at the moment, that has not been done. So I will be reluctant to take this vaccine. But I would certainly take one after Western phase 3 clinical trials, however.
OK, John, just very quickly, when do you think we can realistically expect that type of vaccine?
The Americans are hoping to vaccinate about 50 million people by the end of this year. Mass rollout is going to be April, May, June, July next year. So I would expect that you and me could hopefully be vaccinated by early next summer, is my hope.
John Campbell, health analyst and educator.
Okay.
We'll have to leave it there. Thank you so much, John.
No, that's fine. Thank you.
Let's get a roundup of some of the